All right, Brent
Yes,
Porcio here, doing a great interview today with Dr. Tim Galbraith. Am I saying your last name correct?
that's correct.
Galbraith. And
Mm,
you're a sports medicine orthopedic surgeon. We got to
yeah,
spend a weekend together. You here kind of going through the 3X camp with your son, Cade.
uh-huh.
And it was a great experience, just kind of getting your background and all your information. And that's why I wanted to do this interview. I want the viewers out there to kind of get a medical perspective of what we're doing here. And I think you're a great uh, perspective for that because of your history with baseball. So before we get started, why don't you tell everybody kind of how you came into all this, how you came to the medical industry,
Mhm,
how you came into sports medicine around the medical industry, and kind
mhm,
of fill them in on what you do.
mhm. Well, I was a three-sport athlete, but ended up playing baseball, and I was not good enough to go any further. And so I had a strong desire to study medicine and went into orthopedics and did a fellowship with the guy that specialized in throat injuries, a guy named Richard Caspary. It's been a lifelong interest to me to understand as a surgeon what we can do to prevent an injury before it occurs. If we operate on someone and we don't correct the underlying deficit, the injury is just going to reoccur. So my first endeavor after I was trained was to try to understand biomechanics. I spent a tremendous amount of time. I read every book that was written by every coach known. I spent time with the biomechanics lab in Birmingham, Alabama, trying to understand biomechanics. And the bottom line, what I learned with that, especially with studying kids and injuries, is that you can have perfect mechanics. But the problem is that when we looked at 3D analysis of all the kids, the one common denominator is their core and their kinetic chain was weak. And so basically, you have kids throwing maybe taught good mechanics, maybe not. That could be debated. But the weak link was the kinetic chain, and there's nothing as a surgeon. If I operate a shoulder and they have a weak kinetic chain, they're just going to keep re-injuring. The other concern is, and we've learned more with studies over a period of time, especially that's been supported by the Birmingham group, is overuse. And what we found out is kids in the southern hemisphere of the United States tend to have more injuries than the kids in the northern hemisphere just because they play all year long. And then the importance of taking at least 3 months off. And so other issue is I went back and became certified in age management, which is basically nutrition. And with my time, over doing this for the past 20 years, I've had a lot of kids with simple injuries, and they've had a vitamin D level of 4, or poor nutrition. So nutrition, the kinetic chain strengthening, the mechanics. I'm not sure it's the whole picture that what we look for, not just the shoulder, not just someone comes in with an MRI that's abnormal. That's just one small piece of the puzzle.
Right. So talk about. I mean, are you, how many kids or how many baseball players do you see in your practice? Are you seeing a decent amount, or is it just a lot of different athletes or different general? I mean, how much?
Yeah, well, I'm in a smaller community, so I'm not seeing there's a
Right, a
lot of
lot.
guys be smarter than I am out there, but I'm not sure. I have a huge passion, and I do see a lot of the small college kids, the high school kids. I think it's pretty much the same type of thing. I'm going to do everything I can to try to treat them, encourage them, but so they don't need surgery. I want to do everything to prevent surgery.
So where do we start? So let's kind of give, say, for the parents or the coaches watching this, or even young players that might be experiencing some pain. What's the best advice? I mean, that was you actually gave us a great piece of advice. Take a comprehensive approach, but kind of where should they get started? Like if they're say a parent's got a kid in little league, like do you really want to make them focus on pitch counts, or should they be in some type of obviously general physical fitness training, or where do you start with nutrition? Like what is good advice for kids to start this game? What do you think the best way is to get on the right track?
That is a great question. I think each and every one of those things is important, and that's why it's a complex issue. There's not a simple answer. But I think, first of all, the first question is, should they get a physical fitness and develop their core strength at a young age? Yes. Start lifting, start doing core strengthening at a young age. And I think some of the things that you're teaching is just spot on. I think nutrition is important. Nutrition is a complex subject. Everybody's eating, you're traveling, you're going all over the place. It's tough to have a perfect diet. So supplement and getting involved with somebody who has some training in nutrition is an important thing. I think it's so important, the nutrition aspect of it. I think mechanics, having somebody that understands biomechanics and teaching a kid, it's a lot easier for to change mechanics at a young age than when I get a 20-year-old who has an injured shoulder and their kinetic chain is strong. You've worked with them, and I look at their mechanics and I go, oh my God, no wonder they got hurt. So I think all those things are very, very, very important to do. And so it's a lot easier to change the how you do it at a young age versus an older age.
Do you think parents should be taking a different approach today? They should be not looking on how many team or different leagues they can get their kids in, or how many times of year, or how many seasons they can put them into, and focus on more of what good material or good training can we get them involved in, or can like you said, teach them about nutrition. Shouldn't they have a different perspective than what we really have become caught up in today in the conventional wisdom, that maybe we should be focusing more on just trying to develop the young kids as opposed to just playing them?
Yeah, well, I just told you, that's a great question. Your point's well taken, but I just told you the weak link of the majority of it. There's always exceptions. Almost every kid we checked biomechanics with three-dimensional analysis had a weak kinetic chain, a weak core. So if you take a kid and throw, he could have perfect mechanics, he could do everything perfect, but that weak link, the shoulder and the elbow, and it's going to end up getting the stresses and having an injury.
And paying the price.
And so you got to take time. You can play all year long, but if you don't work on your kinetic chain, you're going to have an injury. And that's where the whole total picture takes into account. We're seeing more and more kids who play all year round doing all this stuff. Especially, they may develop high velocity, but large percent of them are end up with injuries. And so that there's nothing I can do, and you can do, or anybody can do, to totally prevent injuries. They're going to occur, but things we can do to help keep them to a minimum.
And do you think it stems more in the early years of the game? Like I think I told you when I was here, I did that interview with Jim Morris from the movie The Rookie, and he had 9 arm surgeries, and Dr. Job told him, I think on his 5th arm surgery, that, Jim, all the damage you've done to your arm at this point, I think he was 28 at the time, he said you did before you were 15 years old. Do you feel the same way, that a lot of the damage is being done at the young age when the kinetic chain is weak and the arm is handling more of the stress, or do you feel like it just, it can happen at any point?
Well, the American Sports Medicine Institute of Birmingham, Alabama, did a huge study of high school, college sports, and what they looked at. It's a retrospective study of kids, and the only variable they looked at was playing ball. They didn't look at the kinetic chain. They didn't look at nutrition. But of playing baseball, what they found out is kids who did not take at least 3 months off a year were having a tendency to have a higher incidence of injury. Also, they looked at pitch counts. You'd have to look up, to quote, the exact pitch counts per age group. I don't have that memorized off the top of my head, but it's written right in the literature that they have recommended pitch counts. If you're above those, then your rate of injury does go up. Also, going from pitcher to third base, pitcher to catcher, and kids playing on multiple teams have an increased risk of getting injuries because you don't have one person kind of looking over the shoulder. They're going from team to team to team. The other issue is any type of supination. That's where you fall through with a fastball with your thumb up. It's basically like throwing a curveball. That tends to have issues with the inside part of your elbow. And it's more susceptible on the inside part of your elbow until your growth plate closes. The growth plate on the inside part of the elbow closes around 14 to 15 years of age. And every kid can be different. Some a little sooner, some a little different. If you're doing a lot of those injuries at a young age, that has a tendency to have an injury in the inside part of the elbow. So mechanics, throwing a lot, all those are important issues to evaluate.
So do you feel like these kids need to pitch young? I mean, is that why we need pitch counts, is to really not let these kids pitch when they're young? I mean, I feel like when you start looking at a lot of this stuff, we really don't even need to be pitching that much when we're young. I mean, what have you done with your son? I mean, when he was coming up, how much did you let him pitch?
We didn't even play summer or fall ball or anything. I played all sports until recently in high school. The problem is the way the high school sports is involved is they're kind of pushing kids to do one sport, especially in the big schools, because they're practicing all year round, and it's kind of pushing kids to do that. I'm pushing my kid to do more work on the kinetic chain. And we've kind of held him back a little bit in the fall. Last year, he didn't even pitch in the fall at all, and working more in the kinetic chain. And I'm not sure that I as a parent, whether he becomes a good player or not is up to him. It's his life, not mine. So I'm trying to look at sports more as a way for a kid to be accountable as action, learn how to work hard and achieve goals. I'm not sure I'm the parent that wants to train him to be a professional athlete. So I think that's each his own, and I'm just trying to give some good advice.
Right, but I mean, he's not playing more than that 8 months out of a year. You've at least kept
Correct.
him out of that, yeah.
That is correct.
Okay, well, good. Have you experienced that with him? Has he gone through any type of arm pain or anything out of the ordinary?
No, but he's human, and that can't happen.
Yeah,
This
right.
one does not.
So, what are the common injuries we're seeing with the young kids today? Is it mostly growth plate injuries when their growth plates are still open? Is talking about like with the youth or little league? Are we seeing a lot of growth plate? Is that most common for them?
Well, there's a lot of different type of injuries, but I would say for kids less than 10 years of age, probably growth plate is the most common. And one of the biggest issues I get is at a young age, they teach kids some fashion, some rule thoughts, is they teach kids to take the ball when they bring it back all the way to second base. And the problem with that forces you to supinate. And a young kid who repetitively throws, and he's throwing a lot, we see injuries on the inside part of the elbow secondary to that. So one of the big things you want to teach a kid is when he throws, he wants to make sure he falls through with his thumb down. And a young kid who has a small hand, sometimes that's tough. They naturally want the thumb wants to come up when they release. So some of it's biomechanical, some of it's training, some of it's a little bit of coaching that when you bring the ball back, you want to take it back more towards the shortstop than you would second base.
Right. So definitely a high, like you said, young kids need to focus more on the biomechanics, specifically in the arm path at a young age. Develop the kinetic chain so they can develop more core and leg strength to reduce the forces up the chain. Would you find that to be effective? If we can, even at a young age, build their legs, build their cores, you're going to see less stress on those growth plates?
The other thing I see is every time you pitch, there's been several studies, your posterior capsule tends to tighten up as much as 3 degrees per outing. If you have a kid throwing from January to August, and he never stretches, posterior capsule is going to get tighter and tighter and tighter with time. So taking time to stretch the posterior capsule, and you need to get a physical therapist, a coach, or somebody who's educated to teach you how to do that. And take the time, if we take the anterior part of your shoulder, you're constantly doing rotation moving forward. You got to take time to work the opposite direction. In other words, if I stand and do bicep curls all the time and never work the back of my arm, your arm's going to get tight. You have a tendency to tighten down the front part. So always want to take the time to work the opposite side and work in reverse and work the back side.
So along with the legs and core work, obviously all the shoulder strengthening, a lot of external rotation work, a lot of abduction work, and strengthen those decelerators is basically what you're saying?
Yes, and that's why I'm a big fan of you working on strengthening with the full range of motion. In other words, if you do bicep curls and only do it from 90 degrees under 10, you're going to be strong in that range group, but your muscles also going to, in the time, it's going to get a little tight. You want to make sure you strengthen through full range of playing, from squats to legs to your back, all joints, a full range of motion of strength.
So do you see like I do? I see there's too much of an emphasis on upper body strengthening in baseball, at the youth level, all the way up to the college, even I'd say just more when they're still developing. It's this obsessiveness on, obviously you want the decelerators to be strong, but it's like that's all they're going to do. Like you get a young kid and his whole strengthening approach is just external rotation work and shoulder work and like maybe some forearm work. Do you see there's an overemphasis on that and an underemphasis on, like you said, developing the rest of the kinetic chain in baseball?
No doubt about it. I think the baseball community has been a little slow to adopt the total body conditioning training mode compared to some other sports. In fact, I think if you look at, especially in this area of Missouri, some of the best athletes are some of the kids that are still playing football and doing total body conditioning and doing some of the total body stuff. And so sometimes some of the kids and scouts will look at a kid and say, gee, he has potential to get stronger, where the reality is they probably need to be working on conditioning, strengthening, even at a younger age. I think a lot of injuries can be prevented by working on the kinetic chain, strengthening the total body.
Right. So this is when I bring in Olympic lifting because, that's obviously my approach, but it seems to be very taboo still in baseball because of it's just not common. It's not a part of the baseball culture. And obviously I found success in it because I was this underdeveloped kid, tore his rotator cuff at 18, and, was told by baseball not to lift, and I felt like that had set me up for the injury along with bad mechanics. So when I took on Olympic lifting and I opened up to Olympic lifting, I found how amazing it was and making me more athletic, developing the kinetic chain. And then it seemed like I could never hurt myself after that because my whole body was just working together so much more efficiently and effectively. What place do you feel like Olympic lifting, this form of training, being it's a full kinetic form of training, has in baseball? Do you think it has a good place in baseball?
I think it has a good place in all sports, but specifically baseball, because baseball is a total kinetic chain sport. The power you generate is not just your arm and shoulder. I mean, studies show from lower half all the way up the upper half. And so you've got videos on your website kind of documenting that. I think that's a huge deal to evaluate the whole and strengthen the whole kinetic chain.
Of course, when I open up this subject, I get a lot of concerned parents on they just cringe and think injury. That's the first thing they think of is injury. Of course, we can be injured in weight training. Of course, we can be injured in Olympic lifting if unsupervised or not coached correctly. What kind of concerns could you echo maybe for those parents or make them feel better about when it comes to opening or allowing your son or your player to do this form of training?
Well, I mean, any sport, anything you do, you can have injuries. But looking at the rotational 3D analysis we did on the kids and seeing how consistently weak the core is, and you have some kids throwing the ball hard. I mean, we had some kids throwing the ball high 80s and doing some of this testing, and so that would worry me more, have a kid throw the ball high 80s with primarily their arm and have a weak kinetic chain than anything else. And so strengthening the whole chain to take the load off the arm and make it a total body type of maneuver would be much smarter. I think you're going to have a much less incidence of injuries if you pursue that avenue.
I also get the people out there that probably get more critical about this approach more at the college and maybe even professional level. They feel that there's stress, valgus stretch in the front rack position of the cleans. What would you feel, your opinion on racking that clean? Do you feel like it's a lot of valgus stress, or is it just a lot of stress and flexion?
Well, those are technical terms. I think the average person is probably not going to even understand what that means. Valgus has to do with the angle in your shoulder or your elbow, for example. And basically what Brent's saying is it's a stress that can stress the ligaments one side or the other. My take on that is when you do this lifting, it's not like you're training someone to go from 70 pounds to 300 pounds in one day. This is a slow process that you're strengthening that they have to be able to handle the weight. And so your muscles are handling that stress. It's not the ligaments. If they're not strong enough to do it controlled, they shouldn't be lifting it and doing that. It's a controlled strengthening program that everybody is tailored. Everybody's a little bit different. Your muscles are the one that's controlling the weight, not the joints. If the joints are controlling it, they shouldn't be lifting it. That's my take on it and how I look at it. The same thing if I operate on a joint. If I would fix someone's, for example, knee ligament, their ACL, which I do a lot of, the primary strain of anterior translation of that knee is not the ligaments, the muscles. The secondary strain is the ligament. And so what I want to do as a surgeon, I want to protect that ligament the best I can. So I want to make that joint as strong as possible. So you want to push hard to get that strength built back up. That is going to protect them for that ligament as best as possible. So anytime you can strengthen the muscles around a joint, maintain flexibility, work both sides, as a surgeon, that's music to my ears.
Yeah, I've had a couple of other sports medicine doctors say the same thing, that being able to strengthen muscles around the joint is what is going to protect that joint. For example, there is a study that showed that Olympic lifters have more knee and elbow extensor strength than any other lifter. So that gave me confidence that we're probably developing some strength in those joints that are going to make us more able to handle stress on a field, throwing a baseball in a valgus position. Wouldn't you say that that'd be correct?
That's correct.
So where do we go with Tommy Johns from here? I think, give me your take on Tommy Johns. Why do we have so many Tommy Johns last year in Major League Baseball?
Wow, that's a complex subject, and I'm not sure I've got everything to tell you. I think that one of the issues is you've got Major League Baseball paying pitchers a tremendous amount of money. And you go from throwing 88, 90 miles an hour and being a minor league pitcher to 95, and all of a sudden you've got a multi-million-dollar contract.
Right.
And so that's tough to beat. And they're going to do everything they can, and history has shown that, to try to reach those. I think the correct way is to build your total body up. And you would think with the advent of steroids that you would see some of that, because that's what some of them have done in the past. Whether you could argue which ones exactly have done, that could be debated. But you see the results, someone coming in weighing 155 pounds and leaving at late age at almost 250 pounds, can see the difference. So the weight training and everything that you do to develop your body is only going to make things last longer. I think Nolan Ryan was one of the first guys to popularize lifting weights. Don't know his exact program, everything he does, but his longevity, whether it be all genetics, I think some of it has to attribute to his ability to take care of his body.
Yeah, he lifted 80,000 pounds a week, he said, and it was he said he contributed to the success of his career. I mean, he threw until he was 46 years old in the upper 90s. Yeah, it's impressive. And we see now Noah Syndergaard, a big lifter, and he's a 100-mile-an-hour thrower. Chapman's a lifter. So you are seeing weights now being a big player in the game of being a high-velocity pitcher. And I think, but it's unfortunate. I mean, what would you say about baseball? Do you think it's behind the times? Is it catching up, or where is it?
Well, one of the issues when I went back and read every book that I could read about baseball is that they don't have a common language or a common denominator. Different coaches have different terminologies. Different coaches have different strategies for, should I long toss? Should I lift weight? Should I do this? Should I do this? Every coach has a little bit different take on it. And it's tough when you study one coach versus another coach. Not everybody's the same. It's unlike, when we become an orthopedic surgeon, we sit down and we have board certifieds we take away to repair something. Now, there's different ways that orthopedic surgeons repair it. However, we have a consistent results. We follow that, and we sit down and critique each one real close. Baseball has not really at that point to do that, and sometimes it makes it a little difficult when you evaluate different techniques. Some of the long things that they've done in the past has been questioned medically, such as long toss, and it's been shown in the lab to change some of the biomechanics. Whether that be good or bad, I'm not sure I'm here to test, other than it does change the mechanics a little bit when you're throwing. So with time, I think more biomechanics will question some of the things they do, and I think with time, hopefully, things will turn around and it'll change.
I think we probably feel the same way, and I feel the negatives of extreme long toss or even with weighted balls is that you're right. I think it changes the biomechanics, and I think that's where it goes wrong. That's where your development goes wrong, is when whatever training you're doing is training different pitching mechanics or biomechanics that you would use in your skill. Do you find that? Is that a good principle to stick to, or?
Yeah, with the long toss, it holds. I'm not the holds where we're holding the ball fall through. Maybe a little bit okay with that. I don't think I think it's a total body thing. It's something you may want to add. The ball where you throw it controlled, I think we're still waiting on some of the studies. Early studies out of AMSI was only a 6-week study. I think there needs to be some long-term studies to make sure we're not hurting these kids, and I don't think we have it out there to tell you.
Yeah, I've been very concerned. I get a lot of concerned parents on a weekly basis about their kids have been injured through these type of programs. I mean, have you experienced any of that in your sports medicine practice?
I have, and I get that question asked a lot. And so I tell people to be very careful. I'm not sure I'm going around preaching to do that. I'm somewhat intrigued by the holds where we hold on to the ball a little bit just because it works the back part of your shoulder deceleration, and that's one of the weak links of shoulder. I don't mind anytime you work the opposite side. I think it's good. Anytime you stress the body, with the AS, American Sports Medicine Institute studied it, they found that when you went from heavy ball to light ball, you're more apt to throw with the heavy ball. And so that was a short study at 6 weeks. Didn't get any benefit with the 2-pound ball. I would have to go back and look at the exact study, what weight they cut off with the balls. They don't have long-term studies say what they do over a period of time, which is a concern for. I think each kid's different. You can't take every kid out and go out and throw a 15-ounce ball because not every kid's developed enough to do that. And that's where the trouble gets in.
Yeah, once again, if their kinetic chain is weak, you think that would complement.
And you got a kid who's throwing only arm, and then he gets a weighted ball and he's throwing more with only arm. And say his kid's not developed, say his growth plates are open, that worries me.
Yeah, me too.
Long term, I would much rather work on the kinetic chain than try to risk further injury down the road.
All right, well, last question here. I really liked your approach. It's kind of refreshing when you see a medical doctor. You know, when I brought kids around to you that had some form of pain and they wanted to talk to you about, I really like your perspective of, not going right to surgery. You really were, what can we do? And the last thing seemed like to be like you wanted to do was surgery. So if there's kids out there, their elbows are hurting them, their shoulders are hurting them, whatever's hurting them, what's a good protocol for them to follow, if they have some type of pain or injury?
That's a good question. Well, hopefully you can see a very good orthopedic surgeon in your area. There's a lot of bright, good guys out there, a lot probably brighter than I am out there. So see a good orthopedic surgeon, good physical therapist, and do a total body evaluation, not just you're throwing from a good coach to mechanics to a good strength coach, the whole issue, and kind of look at it. Remember, an MRI is not exact science. It's just one piece of the puzzle. Make sure the injury, as an orthopedic surgeon, I'm telling you what we do, is make sure the injury in the exam is the same. So in other words, if someone comes up with an MRI and they have a possible slap tear, and I examine them and they have no signs or symptoms of any bicep tenderness, any slap on exam, I'm going to do everything I can to treat that conservatively. Make sure the exam matches what the MRI findings are.
And do you find a lot of orthopedic surgeons want to jump to surgery today?
Well, that's tough for me to examine. I'm not sure I can attest to that across the board. I think every person's different. Every orthopedic surgeon's different without looking at every case. I'm just saying in my practice, what I would do is do everything I can to try to avoid surgery as best I can. And so, Tommy John, I don't even do Tommy John where in my practice. There's a few guys in the country, just a lot of them. I'm going to send it to somebody that does 100 a year. Anytime you have somebody that does a lot of operations, you want to make sure that they do a lot of them because they've seen everything, done everything.
Right. Awesome. Look, I want you to let them know where your practice is. So tell them where you're located. And, there might be some guys in your area that might want to come find you. I'm
in Jefferson City, Missouri, and independent orthopedic surgeon in mid-Missouri.
Awesome. Hey, I appreciate you doing this. I just wanted to kind of give that medical perspective to what I'm trying to do, developing players, and I think you helped provide that. Any last words you'd want to say before we head off?
No, I think you covered bases pretty well, and so I think the big question I get is how early or how young can I start working my core, such as Olympic training. I think you can start it at a young age. There's no science documented that you can start at a young age. I think the weight, make sure a kid can lift it comfortable, make sure he's doing it correctly. But I'm a huge fan of Olympic training, even at a young age with joints and strengthening a full range of motion. Now, there's other ways to do core strengthening. There's tons of stuff you can do. But some type of training at a young age and start teaching them correctly. The kid who's young and he's not mature is not going to be producing testosterone, so they're not going to have huge gains. But you can teach them to do it correctly and then start working on some of the core strength.
Yeah, so when they get to high school, then they have a good base, a good foundation to then build off of. Yeah,
that is correct.
Awesome. Well,
Yes.
I appreciate it, Doc. Thanks for taking your time from your busy day to do this. And
Have a good
thanhanks, man. I'm
day. All
you
right.
too. And
See you later.
stay on the line. I'm just gonna.